Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's show you how we adjust for migraines. So lots of different ways we can adjust, just like anything else, where we find ways that are going to make the patient feel the most comfortable and get this specific patient the best results. One way we'll oftentimes adjust is using the Activator. We use this for a lot of different things, but sometimes when patients are really flared up with a migraine, the Activator works well because it's going to get right into the specific segment where you're getting symptoms and where that restriction is, and it's going to be a light impulse. We can do this with a patient sitting up or laying on their belly face down. The next way that we'll adjust is what we're going to do with Max today, and this is the most common way that we adjust is going to be manual adjustments. And so this is all after we've done our exam and figured out what's going on with you, and we went through and found where you have those symptoms and where you have those subluxations that are contributing to your migraines. And so we'll work up and down the neck here, and so we'll find the segment that needs adjusted. We're going to lean Max to the side and turn his head. And it's just a little gentle pressure right here. We're just holding. And he's relaxed. And there's a quick little bump. It's a quick movement. We're only moving a tiny little bit. And that forces that joint to release and is going to make a big impact on how their brain is connecting with the rest of their body. It's impacting your nervous system. So we'll check the other side. Now, oftentimes when we're getting migraines, we're getting these subluxations way up high, usually C1 or C2. That's contributing to that. So there's one right here on Max. Same thing. Quick little thrust that's going to get that joint moving again. Most patients describe pretty immediate relief or an immediate impact on how they're feeling. The next thing that we'll do with some migraine cases is we're going to check the cranium or the skull. Now the skull is made up of a bunch of different bones. It's not one big bone together. It's all of these different bones that move together. I tell patients oftentimes they're like tectonic plates within the crust of the earth, where they don't really move. The earth stays round, but they also do kind of move. Ask people in California, earthquakes are a thing, right? Same thing within our skull. These joints can get stuck or misaligned. And so we can go through, and this looks rather anticlimactic, but we'll find one of those sutures that's not moving well, and we'll have a little bit of a force on it. And so all I'm doing is I'm pressing onto it and holding into a direction it needs to move. And so we'll do that. We can also do some other ones where we play with how the front and the back of it move. And so we'll have a hand on the back and the front, and there's just a slight shear force, not much at all, that's going to help move those joints and get that motion, getting that CSF, that cerebral spinal fluid, that fancy blood that sits around your brain, to move up and down through the spine and pump that through, helping eliminate and decrease these migraines. Now, adjustments are one of the biggest things that we do for migraines, but we've got other modalities and tools that we use as well, as we talk through in other videos, but this is going to make a big change in how Max is feeling and functioning. If you've got more questions on how we do this with a patient like yourself, come on in, let's chat about it.